Good afternoon, everyone, and thank you for joining us for another community conversation event. It's Friday, December 18th, and we're very pleased that you've chosen to join us this afternoon for another opportunity to hear an update from some of our local health experts, as well as have an opportunity to ask some questions of these fine individuals. My name is Lainey Hendricks. I'm Public Information Officer for the County of Marin, and I will be your moderator for this afternoon. So today we have a wonderful lineup of panelists that will first provide an overview to you of what's happening with our COVID-19 response, specifically touching on some of those hot topics that we've heard of this week on ICU capacity and the arrival of the much anticipated COVID-19 vaccine. So with that, I will go ahead and introduce our panel and we'll get started with our program. So returning to our airwaves here is Marin's Public Health Officer, Dr. Matt Willis. Thank you for joining us again today. We are also joined by Max Corton, who is our Director of Marin County Parks, but this year has been really spearheading the effort of the Marin Recovers Industry Advisors and guiding our business reopening process, as well as working on the policy efforts that are rolled out from the state and helping our businesses with those things. And then finally, we have a special guest this afternoon, Dr. Karin Shabelson, who is the Chief Medical Officer for Marin Health Medical Center. So with that, Dr. Willis, I'm going to hand it over to you to start our presentation.
Great, thank you, Lainey. Good afternoon, everyone. Matt Willis, Public Health Officer. Thanks for this opportunity to speak about where we are right now with our COVID-19 pandemic response as a county. And offer some information about some exciting news that we're experiencing this week, as well as some real concerning news around the crisis that we're also facing. Could I have my slides, please? We'll start by going over some of the data that shows and indicates the scale and scope of the surge in cases that we're experiencing. And then I've invited Dr. Shabelson to join us to describe how that experience is being manifested in the hospitals and how they're reacting to the surge in cases, and how we can, as a community, protect our most precious resource, which is one another and our healthcare system. Next slide, please. Next slide, please. So this is our epi curve. This is when we talk about flattening the curve, this is what we're talking about. This is the number of daily cases per day. And what this shows is essentially that, we have just in the past few days exceeded now the peak that we had experienced in that July interval of our surge. And what's particularly concerning here is that the slope of the acceleration of this curve exceeds that we saw in July. Where really that slope began in May and gathered momentum through June. We're seeing a much more rapid acceleration, and the steepness of this slope tends to predict the height and eventual total number of cases involved. So it looks from this epi curve that we are entering a really challenging time in terms of the next few weeks. Next, please. And this reflects that as well. This is our patient census in our hospitals and intensive care units. Comparing our spike now to the spike that we experienced in July, we are about the same height there. We have, I think, more patients in intensive care unit than ever before in Marin. Importantly, remembering back in July, a significant fraction of those cases we are experiencing were from the devastating epidemic that was happening, an outbreak at San Quentin State Prison, where there was a total of 2,500 inmates who were infected in that outbreak, with over 200 hospitalizations, with Marin County taking a significant fraction of those patients into our hospitals. So if we remove that contribution to our July cases, we're seeing a much greater increase in cases than we've ever seen before among non-San Quentin Marin County residents. Next slide, please. And this just, articulates the obvious, I hope, which is that hospitalizations and intensive care visits, which the hospitalizations are represented on the solid red line and ICU visits on the dotted line, follow cases. obviously the first event is an event of transmission, of infection, and then someone may get tested and they become a case. And then some fraction of those cases, usually it's about 5 to 10% of people who are identified as cases will come into the hospital and require hospitalizations. And then about 1 in 3 of those individuals might need ICU care. So each day when I'm looking at our case numbers, I'm always doing that math to try and understand what are our hospitals going to experience a week from now or 2 weeks from now. And the problem is that the crisis we're experiencing right now is that math is not adding up. We are having more cases per day than our hospitals will be able to accommodate if this pace of surge continues. Next, please. This is an important point, I think, for all of us, especially as we face our next holiday. This was the experience of Thanksgiving. We had seen increases in cases over November. The pump was primed on November 26th for Thanksgiving for indoor gatherings to fuel even greater transmission. And indeed, that's what we saw. So 4, 5, 6 days after Thanksgiving Day, our number of cases jumped significantly, and the percent positivity also increased. Very likely attributable to transmission that occurred on that day that preceded it. And the concern there is then that those rates have continued to increase from there. So it was a surge on top of a surge. And now if we have even more gatherings around Christmas and other holidays, we will see an even greater surge that would put us even further behind in early January and through January. So it's an important cautionary tale for us that we've already seen what a single holiday event can mean for us in terms of surges and cases. Next, please. And coinciding with that, we have a new pattern in the epidemiology of this pandemic in Marin. On the left there, you see what was occurring in July. The red dots correspond to our Latinx residents, and we all remember that really the dominant experience was in our low-income Latinx communities, Center Falcon areas of Novato. Those are represented by those larger red circles on the map on the left. On the right there, and the size of the circles represent the number of cases, and they obviously represent where those cases live. The littlest circles are just one case. If you look on the right there, you see that it's a much more widely dispersed across our community, and it's more racially diverse. We're seeing now the majority of cases are among our white residents, and they're occurring in every city and town across the county. Next, please. This is the good news that Wednesday morning arrived in here at the Emergency Operations Center our first doses of the COVID-19 vaccine. It seemed remarkable that it was just a box. A box just showed up here on dry ice, FedEx, and that was the beginning of our vaccine distribution, which will endure for at least 6 months as we seek to vaccinate anyone who is willing across our 260,000 residents in Marin County. This is the Pfizer vaccine that requires ultra cold storage, and I'm putting the tray there into our ultra cold storage freezer that was donated by BioMarin. Thank you. Next slide, please. And we immediately went to move our vaccines out of our storage and into the hands of our healthcare providers and into the arms of our healthcare providers for the first vaccine. And this was an event at Kaiser that afternoon, where they began vaccinating their emergency department staff. And the gentleman on the upper right there was the first Marin County resident to be vaccinated. And he was an orderly who had worked in the emergency department for several decades and was an older gentleman who qualified based on being on the front lines in the emergency department and also by virtue of his risk because he was an older resident. So it's really, an exciting moment for all of us. Next, please. And then the next day, we were out at our skilled nursing facilities, and there are teams right now as we speak in 2 of our skilled nursing facilities vaccinating staff there. This was an event that occurred yesterday at the Tamalpais um, uh, assisted living and skilled nursing facility in Greenbrae. And I think there was about 100 staff vaccinated on that day. Very festive atmosphere. Literally, there was music playing, there were people dancing at the same time in parallel to the vaccination operations. Just a remarkable event. Next, please. This shows the different tiers. We are now in phase 1 of our vaccine distribution plan. We're vaccinating healthcare workers, and these are the different tiers that we will move out sequentially week to week as we get more vaccine supplies. Marin Health is also vaccinating their staff, and Dr. Shevelson can speak more to that briefly. Next, please. And this is taking a step back, our general experience of how we'll be distributing the vaccine over the course of the next 6 months or so in Marin as the supplies come into our county. And these are 3, each box corresponds to a phase of our vaccine distribution plan. So on the far left there, mid-December through late January, that's our phase 1. We're vaccinating healthcare workers, first responders, long-term care facility residents. Then we move into phase 2, which are non-healthcare essential workers in critical infrastructure and higher risk community members. And then finally into phase 3, where we're vaccinating the general population, hopefully March through June. The more vaccines we can get, the better. The production lines are moving as quickly as they can. Next, please. And then briefly, this is we have an increase in our testing operations. Just wanted to call your attention to the fact that we now have every day of the week, there will be a mobile, of weekdays, there will be mobile testing available in these locations throughout Marin, starting as early as on Monday. They'll be in Molinas and San Geronimo. On Tuesday at United Market and San Anselmo. And then starting in early January, Wednesdays in Sausalito, Thursdays in Larkspur, and Fridays in Novato. And that's going to be a self-scheduling platform through Curative. You can go to this website. They'll have about 500 tests available per day. Right now, we're doing about 2,500 tests per day in Marin County. We have some of the highest testing rates of any county. And this will add an additional 2,000 or so tests per week for us. More opportunities for people to get tested. Next, please. And this, before we show the video, I just want to introduce this. This is, we really want to make the point, I as public health officer have for a long time been talking about the shelter in place, talking about the importance of physical distancing, covering our faces, and following the public health guidance. But now, because we're getting into this critical stage where it's impacting our healthcare systems themselves and our healthcare workers, we thought it was important to invite them into this conversation also. And we're grateful for Dr. Shevelson for joining us from Marin Health. Kaiser has offered us a series of testimonials from some of their physicians, and this is one with Dr. Lafamina at Kaiser.
My name is Mike Lafamina. I'm one of the pulmonary critical care doctors in San Rafael. This is baby Oscar. Baby Oscar was actually born during the pandemic, and I remember when he was born, I was so grateful to the community because people staying home allowed the virus to be controlled and allowed him to have a nice, safe delivery and get the care he needed. We're in the middle of another big surge right now, and once more, we're so grateful for people staying home and for our public health department because the community is a really big part of our response and allows us to do our job and keep our loved ones safe throughout this very hard time. Thank you.
We stay here for you. Please stay home for us.
Awesome. Thank you. We stay here for you. Please stay home for us. And now I'd like to introduce Dr. Karin Shevelson. Karin is the Chief Medical Officer for Marin Health Medical Center. Next slide, please. And Karin has been, is a relatively new addition, at least as an executive to our network of healthcare in Marin County, and has just really hit the ground running, has been an excellent partner It's such a critical time for us to be working in close partnership, both for managing surges and cases, and now for the exciting and important work of getting our vaccine out into our healthcare system. Go ahead, Karin.
Great. Thank you, Dr. Willis. Hi, everyone. Good afternoon and happy Friday. I know there's probably a lot of questions, so I'm going to do my best to explain a little bit about what ICU and hospital capacity means. So forgive me if we get a little bogged down in numbers. I'm going to try to avoid that. And then secondarily, I'll speak briefly about vaccines and share the exciting news about the vaccine starting here at Marin Health Medical Center. So as everybody knows, hospital and ICU capacity is a concern right now. The way that hospitals manage their beds and their capacity is a bit like air traffic control. It's very fluid. There are patients coming, there are patients going. There are unexpected admissions. Obviously, we have no idea what the flow through the emergency room could be at any time. And so it requires a lot of pivoting and for us to be very flexible. The way we staff our hospital is based on historical data. We have some idea of trends. For example, we know that the winter months are often very busy. There are respiratory viruses, influenza, and other things that lead to increased hospitalizations. So we take all of that into account. What we're seeing currently is our normal winter uptick combined with, as Dr. Willis explained it, the surge that we're all experiencing right now. So it's important to understand that ICU capacity currently is existing expected uptick plus additional COVID patients. The normal winter uptick keeps us very busy. The addition of the COVID patients, well, it makes us even busier. Right now, we use our existing surge protocols just as we use every winter, and we're accommodating patients and able to care for them as per our usual and normal winter surge operations. But we're definitely seeing a trend towards more patients, and that applies to both the entire hospital and the ICU. The way that Dr. Willis and the 3 hospitals in the county initially defined ICU capacity was based on a number that would reflect our average everyday ICU capacity. So not our winter uptick, but on a given day, what was our normal census in our ICU? And all 3 facilities agreed that that's somewhere close to 75% of our licensed beds. So at Marin Health Medical Center, we have 19 ICU beds in our new Oak Pavilion, and 75% of that would be roughly 14 patients. So that's the number that's capacity, but it doesn't mean that we can't take care of more patients than that. We absolutely can, and we do every winter. We are currently, right now we have 17 patients in the ICU, but to give you a sense, 4 of those are COVID patients. So what we're seeing is our existing expected winter uptick. I think there's also a component of patients who may have put off some of their medical issues during the early stages of COVID. I think we've all heard stories about people with diabetes that became more difficult to control and things like this. There are definitely people that delayed surgeries that maybe weren't emergencies, but rather more urgencies, big important surgeries. And people are starting to want to have procedures done that they put off earlier this year and this summer. So all of this is combined such that, yes, we're definitely seeing more patients in the ICU. We also have the ability to expand our ICU beds, and will do so if necessary. It's unusual. It's not something that we've never done, however, and we have contingencies plans well laid out. I think it's important for the community to understand that one of our most valuable and limited resources, and it's one that we're not calculating but needs to be considered, is our healthcare workers. The nurses, the doctors, the respiratory therapists, all of the team of individuals that come together as a group to care for patients, whether it be in the ICU or in the hospital, are valuable assets, every bit as important as the actual bed or the number of ventilators or any of the other things that we're counting. What's also different this year is that in years past, when we would see our normal expected winter uptick, we could rely on a vast pool of additional resources, such as what we call traveling nurses, who are per diem nurses that work at different hospitals throughout the country and can be hired on a short-term contract to help us when we see an uptick. What's different about this year is those nurses, for example, have already been deployed to other parts of this country that were in surges, Texas, all the other places that we've heard about. The nurses are working there. So we aren't as able to call on this pool of additional human resources to come assist us should our numbers continue to grow. That is one of the imperative reasons that we all try to stay as safe as we can. And seeing Dr. Willis's slides about what happened over Thanksgiving is a cautionary tale. It takes years of training and experience for a nurse to be a seasoned ICU nurse. And so we have to really consider that one of our most valuable assets. So that gives you a little bit of a sense of what we mean by hospital capacity. I think that Dr. Willis is working on a plan to lay it out in a little bit more nuanced approach that will help the public understand that don't be concerned that there are no ICU beds at the moment, but understand that we've moved in to a bit more of an uptick winter surge planning. And if the numbers continue to climb, we'll expand our surge planning further. I hope without getting into the details of hospital operations, which is a very nuanced form of air traffic control, that helps everybody understand what's taking place right now. The second really exciting news, and it really offers a bit of light at the end of the tunnel, is the vaccines. So we're very excited to begin our vaccination program for our frontline healthcare workers yesterday morning, shortly after 10 o'clock at Marin Health Medical Center. We vaccinated just shy of 140 people yesterday, and we're on track to do far more than that today. There were no serious side effects. Everybody's tolerated it well. We've all been checking in with one another, and things look really good. Many of us registered for the CDC program where they track any side effects. And actually, while I was waiting for my turn, I got a text on my phone from the CDC asking me to report if I had received, if I have had any side effects. I did receive the vaccine yesterday. It was completely painless. I chose to have the vaccine in my dominant arm, which is my right side. And it's a little bit sore today, I won't lie, but not hardly as sore as it was for the tetanus shot, and roughly about the same as the flu. So everybody is very excited about that here at Marin Health. And we're just very thankful for our collaboration with Dr. Willis and his entire team. It's you try to find silver linings during COVID. And I think seeing the healthcare community come together and work so closely with the county team and Dr. Willis has really been incredible. I know that none of us would have wished a pandemic push us to this, but let's find those silver linings. And I'd really like to thank everybody at the county for all of their help and support. So I'll stop there and turn it back over to Dr. Willis.
Thank you. Thank you. Yeah, right back at you. I mean, I definitely, one of the silver linings of this whole experience has been how the relationships have been strengthened across the healthcare system, and even beyond. You know, our relationship with the school community, the law enforcement community, our relationships between one another as community members. And I think that will be enduring. I mean, the relationships we forged with you at Marin Health, Dr. Shevelson, Kaiser, Novato, between ourselves and between one another, I think are going to make our healthcare system just that much stronger to serve our ongoing community needs. So thank you, and we'll have a chance to, in a question and answer, to get more into some of the issues that Dr. Shevelson raised that I know are of particular interest to our community based on the questions that are coming into my inbox. Why don't we now go to Max Corton, and Max will talk to us about the stay-at-home order. Some of you may have just received a WIA alert on your phones indicating that we are in a stay-at-home order. So this is really well timed for Max to help explain what that might mean. Thanks, Max.
Thanks, Dr. Willis. And before I get started, I'm going to turn it back over to Lainey, who's going to talk briefly about how to ask a question.
Yes, thank you, Max. It's something that I failed to do at the start of our program. Although I like to believe that all of our close to 170 participants are actively listening, but I'm sure you're also thinking on questions. So wanted to let you all know, questions can be submitted live, and we're going to get to those here in just a minute. If you're joining us on Zoom, you can click on the Q&A button that's just at the base of your Zoom browser there, and type your question in directly. If you're viewing this on Facebook, that is, you can click the comment button to type in your question. And we have a support team that's monitoring questions on both platforms. So go ahead and start asking those questions, and we'll get to those in just a minute. And one more note, we have seen a few comments online about parts of this broadcast being blurry. And so I want to let you know that we are recording this session, and we will upload it to our YouTube account later this evening. So you'll have an opportunity to rewatch that, and hopefully it will not be as blurry on the replay because it's not being broadcast live. So thank you for your patience with that. And Max, back to you.
Thanks, Lainey. So if we could bring the presentation back up. All right, and go ahead and go to the next slide, please. So yeah, the next few slides will just be describing the stay-at-home order. We've been under this order now for over a week, but because the Bay Area public health officers chose to start the order early in the hopes of reducing the severity of the surge and the length of time that we need to be under these additional restrictions. But just today, we're now entering the order under the mandate of the state because our ICU capacity for the Bay Area region has dropped below 15%. And you can see, let's see, maybe it doesn't show right now. It looks like 3% is the whole state. So if we go to the next slide. So here's some specifics about the stay-at-home order. Unfortunately, all gatherings with members of other households are prohibited at this time. And of course, we've all been figuring out ways to gather with people outdoors in social bubbles. And unfortunately, we can't do that at this time. All individuals are asked to stay home except for operation or usage of critical infrastructure. And so critical infrastructure sectors are allowed to operate. That includes construction, number of other sectors. Schools that had already reopened are allowed to continue in-person instruction. Worship and political expression are allowed outdoors. And then retail is allowed at 20% capacity, except for grocery stores, which are allowed at 35% capacity. For dining, indoor and outdoor dining are not allowed, just takeout and delivery. And then personal services like hair salons and nail salons are not allowed to operate at this time. But one thing to highlight is of course, important, dear to me, because I manage parks usually, is that outdoor recreation facilities are open and you're encouraged to get outdoors. It's one of the few safe, healthy things that folks can do, good for your physical health and mental health. I know that our governor has spoken about this, Dr. Willis has spoken about this, and so encourage folks to be outdoors and get healthy exercise. Next slide, please. And you can find information on the state's website. It's probably the best place. Of course, you can also check out the Marin County HHS website as well as our Marin Recovers website. And I think that's last slide. Yeah, so, and I don't know if Dr. Willis, do you want to wrap this up and then we can go to questions? How about we just go to questions?
Sorry, yeah, I was stuck in a muted space. Yeah, so just to summarize, there are surges in cases and hospitalizations, which is a crisis regionally. That what Max showed there is a 3% ICU capacity. That means that there is a 3% across the state. The entire southern part of the state of California has 0% ICU capacity now. And that's, Los Angeles, Orange County, San Diego, all of the San Joaquin Valley are at 0%. So we have, I think there were 60 individuals, 60 patients that were needing critical care from that southern region that we were asked whether or not we would be able to accommodate them here. We are reserving our beds for our own residents, recognizing that we are also experiencing surges here. And that's the image, that's the picture that we're trying to prevent here in our region right now. Our ICU capacity as the Bay Area region is about 12%. And that unfortunately has shrunk significantly, which is why today you received the notice that the governor had placed us in the stay-at-home order to protect that dwindling resource. So the next 2 weeks, I think this is the most important single step, really, which is the next 2 weeks are critical for us to prevent mortality. If we see increased transmission in Marin County over the next 2 weeks, I'm very concerned, despite what Dr. Shevelson articulated about the elasticity and the capacity for our hospitals to scale up, that is at some point a limited resource. And we are beginning to reach the margins of that resource as being demonstrated across the state. The stay-at-home order is in place and is in order to protect us all. And fortunately, amidst all of that, the hope that the vaccine is here in limited supplies. Next slide, please. So don't forget to get your flu shot if you haven't yet. My goodness, here's something that you can all do. It's an easy, safe, simple thing to do. And as Dr. Shevelson mentioned, we haven't really started seeing surges in flu cases yet. Every year that actually does get us to close to ICU capacity, for normal ICU capacity as we define it. Fortunately, the steps we're taking to protect ourselves against COVID-19 are also protecting us against flu. The added measure of protection that the flu vaccine offers is critical for us right now, because the last thing we need is to be managing a twindemic of influenza as well as COVID-19. Next, please. And we'll get into questions and answers now. For Lainey.
Wonderful. Thank you, Dr. Willis. If you did join us a bit late, this is our community conversation event for December 18th. And we are joined here not only by Dr. Matt Willis, Marin's Public Health Officer, but also Max Corton, who is spearheading Marin Recovers Industry Advisors, and special guest, Dr. Karen Shavelson of Marin Health Medical Center. So now we're going to dive into those questions that you have submitted thus far. Remember, you can submit those at the base of your screen if you're on Zoom using the Q&A button, or in the comments on Facebook. So with that, I'm actually going to start on the topic of ICU, and I think maybe Dr. Shavelson, this is a good question for you. Earlier this week, Marin Public Health indicated that our ICU capacity had reached 0% capacity. Can you clarify for us how we go about calculating that ICU capacity? I realize you talked a bit about balancing staffing needs and that sort of thing, but this term of functional capacity that Dr. Willis introduced us to, how is that calculated?
So functional capacity is 75% of licensed beds. And Marin Health might be a little bit confusing in that if one is to look up licensed beds on perhaps the state website, it will include the ICU beds from our old hospital and from our new hospital. We didn't de-license the beds in the old hospital, but we're only using the 19 beds in the new Oak Pavilion. And realize that ICU numbers fluctuate all the time. That report is a moment in time. So for example, every day we're reviewing our surgical cases for the next day, particularly if they would require an ICU bed. So there is a lot of high-level discretion of the management of the ICU beds at the moment. So I think for a member of the public to know exactly how many ICU beds are available and exactly what our capacity is, it changes rapidly. And this is not to suggest that none of you or any of you are capable of understanding it, but rather because it changes so quickly. It's a moment-to-moment sort of event. But as I mentioned earlier, we're defining our normal ICU capacity under normal operations as being 14. but we have 19 beds and we have other spaces that could be used for ICU care of patients. I hope that answers the question.
I think it will, hopefully. Unfortunately, we can't hear the person that submitted it respond, but I think that helps clear it up for at least for me. So
can I add to that real quick? Just from having worked as a hospitalist, I think it's really important for people to recognize that these decisions are made, not day to day, hour to hour. It's really minute to minute decisions. If someone comes in who needs a critical care bed, there's an immediate evaluation of where is there room in the system to accommodate that need. And there might be someone who's been in the intensive care unit for a few days, who's recovering, who's healing, and can be moved out of the intensive care space to make room for that person to come upstairs. Or people are able to be discharged, transferred, et cetera. So again, just to reiterate the point that it's really minute-to-minute decision-making, and any sort of static reporting structure where we say, okay, here's our capacity now, if it's offered on a 24-hour basis, is bound to fail to capture that nuance.
It really is, as Dr. Willis is saying, it really does look like air traffic control for one of the busier airports in the world. I mean, it's in flux, it's in play, and the minute you think you have all your pieces where you want them to be, there's a car accident and we get a full trauma coming into the emergency room. So we have learned to, we can move very quickly. We know how to do this. We know how to rearrange the pieces of the puzzle to make things fit. But as we've talked about on this call, if COVID continues to spread, if the cases continue to rise, it will strain the system at a certain point.
So a follow-up question to that about an increase in COVID hospitalizations. The ones that we're seeing locally, are those actually local Marin County COVID cases, or are we accepting COVID patients from other areas?
Do you want me to answer that, Matt?
Yeah, you can start.
Yeah, so we did, I believe it was last week, receive some calls from other counties, and in consultation with Dr. Willis, we did not and have not yet accepted patients from outside of Marin County. So currently, all of our patients with COVID are largely, I'd have to go back and review each one, but they're largely Marin County patients. As you can imagine, sometimes we do get patients from the outlying counties because they've received their care here, or one of their doctors is in Marin County, but it's largely Marin County residents, yes.
Yeah, and that's a critical point from my perspective in terms of public health, which is that it's community transmission in Marin County that is fueling surges of demand for beds in Marin County hospitals. And that now we are at a point where, again, we've had more patients with COVID-19 in the ICU than ever before. Our hospitals are at that and starting to move into that space where they're increasing their capacity beyond their normal capacity. And that's a pattern that we're seeing happening all around us, with 0% ICU capacity in the entire southern aspect of the state. And so we're not able right now to receive patients from the outside, despite the demand for that. And that is a concerning reality. If we reach that point in Marin that they are already at in Southern California, where they are trying to find beds outside of the region, we are unlikely to be able to find room for patients to be transferred out. And that's it's not a negative reflection on the quality and capacity of our system. It really is more a reflection on the fact that the system as a whole right now is being constrained in unprecedented ways. Normally, it's one area or another area that might be getting stressed. And we can flex those resources and move patients if we need to, or receive patients that are from other areas for the sake of those communities. That's part of the ethical responsibility, and all of our hospitals take that very seriously. The problem is when every system is under stress simultaneously, there are simply fewer and fewer places to put people, which is why it's so critical that we do everything we can to prevent becoming infected or infecting others, and that's by staying at home.
Okay, thank you for that. And then we have a couple of questions that relate to surge capacity planning, since we talked about, you guys touched on that, and also questions around, for example, Dr. Shavelson, you mentioned, 19 beds, but the 75% is the 14. So why not utilize all the beds we have now, right? So maybe either one of you could walk me through a very high level overview of what does hospital surge planning look like, and when do you determine when to pull the trigger on, stretching, expanding, and then if we need to turn to surge planning outside of the hospital, meaning, we have a question specifically like, does surge planning involve tents outside the hospital, like medical field hospitals? So I realize that was a mouthful. So perhaps you can just give a high level overview of the triggers of the different levels of surge planning. Does that make sense?
I'll speak for Marin Health, and then maybe Dr. Willis wants to talk about how the county might handle some of that too. There's no single answer to how we handle surge planning, in that every circumstance is different. As Dr. Willis and I have mentioned, it's air traffic control, and the general idea is that we move patients to the areas where they receive the care that they need. And if we find ourselves beyond the 19 ICU beds, we have other space within the hospital that is licensed for ICU level care. I want to reiterate that one of our rate limiters are our skilled healthcare workers. And so if we can do everything possible to recognize the strain this places on personnel, both personally and professionally, I think if folks could recognize the healthcare workers have been fighting quite the battle for quite some time now. And here we are in probably the greatest fight of this entire battle. And how you can help all of us is by doing exactly what Dr. Willis just said, and that's to stay home and to wear a mask and to socially distance. And that will help our hospital operations. We have detailed, elaborate, lengthy plans, and there's constant communications. There's no single answer though, because every circumstance is different. There are different mixes of patients. There are different options for how we do things. So unfortunately, it's very challenging for me to give you a single answer, other than to reassure you, we got this, we know how to do this. If we feel that we're pushing the limits of what we can offer at Marin Health, we have a very collaborative relationship with the other two hospitals in the county, and we will work with them just as we did during the San Quentin outbreak. We worked very collaboratively, and Dr. Willis might want to speak more to that. We've also received offers of help from outside of Marin County. Healdsburg Hospital reached out to us and said, we have some beds if you need help. We hear you're busy down there. So while we're not at the point that we're sending patients out of the county or bringing patients into the county, we have options available to us, and we'll evaluate those in a stepwise fashion.
Dr. Willis, anything to add?
No, just that there's, the alternate care site right now, obviously the state is recognized that there's surges happening simultaneously almost across the state, and that they are mobilizing the large scale, multiple, many bed facilities in strategic locations across the state as alternate care sites. There has not yet been the mobilization of a site like that in the Bay Area. Our ICU capacity across the region is 12%. As Dr. Shavels had mentioned, the first would be, internal changes in operations. And then once that capacity has been reached, it's through relationships with other hospitals. Fortunately, our hospitals are really very collaborative. And we, demonstrated that in the response to the San Quentin outbreak, that we reached a point where they were having up to 20 transfers out on some days from that facility. And it was simply impossible. Marin Health is sort of the default for San Quentin. It's the closest hospital. There's regulations that say when someone's in an emergency state that they go to the closest physical hospital. That's Marin Health. So they were really receiving the brunt of that. Once they were nearing capacity based on that, the other hospitals really, in a collaborative conversation, just stepped in, and we figured out a process where, as patients were coming out of San Quentin, they would be allocated to all three of our hospitals. And that's the way we'll roll. That's the way we'll continue to manage this situation. If one of our hospitals gets to that point where the next critically ill patient that rolls in might not be able to find, through some of those strategies Dr. Shelton outlined, care within that setting, we have other hospitals that would be the first go-to within our system, or within their network. So Kaiser has other hospitals in their network, Sutter has other hospitals in their network. So that image of tent-based care or an alternate care, care site-based care is really much further down the road. The first is really, as we've already articulated, staying within the bricks and mortar of established hospital systems.
Excellent. Thanks for that clarification. So with that, I'm going to shift gears to a different topic. We have a lot of questions about vaccines. And the first one is talking about the fact that we're prioritizing our healthcare workers. The question is just wondering that distribution for essential healthcare workers, is that determined by those that live in Marin or those that work in Marin, since we know we have a fair bit of our workforce that does come in from other neighboring counties?
It's because it's an occupational designation that tier is defined by their status as essential workers on the front lines. They're caring for our community. Many live in Marin and many don't live in Marin, and it doesn't matter. They're equally valued, obviously, and essential, and we are vaccinating staff regardless of where their county of residence.
Awesome. You mentioned earlier the effort to vaccinate staff at our skilled nursing facilities, and we have a question asking with some of the outbreaks that we've seen at skilled nursing facilities, how does that affect Marin Public Health's ability to vaccinate a particular facility, especially if there is one that is currently experiencing an outbreak? And then what impact are any cases from those skilled nursing facilities having on our ICU?
So I can take the first one, and then maybe the first part of that, maybe Dr. Chavez can take the second part. So the first part is, yes, I mean, this is one of the remarkable aspects of this time, right? Which is we are experiencing busy, operational constraints, right, in our healthcare system because of surges in cases. At the same time, we're adding this whole new complexity of vaccinating healthcare staff, and they're happening simultaneously. And one will eventually address the other, right? Once we're able to get people vaccinated, there's going to be a lot less of that surge, and the hospitals, the level of protection of those healthcare workers who are taking care of surges as they occur will increase. So it's critical to continue to prioritize vaccination despite all the work to manage surges, and that's happening in the skilled nursing facilities as well. We're doing it outside. I mean, there are right now 12 of our long-term care facilities are having some form of outbreak right now, as a sign of which is when it lights up like this across the community, it lights up everywhere, and we start seeing more and more outbreaks in these long-term care facilities. So, we couldn't move quickly enough to get them vaccinated. So we are going to vaccinate regardless. And those facilities that are having outbreaks, we're going to do the vaccination operations anyway. But we move it outside. We do it. Everyone's fully PPE'd up for even just the vaccination thing, or assuming that anyone that they encounter may be infectious, even if they're not having symptoms. And we've got those operations nailed. And the vaccine is effective for people that have been, if you've been infected in the past and you recovered, you should be vaccinated anyway. So it's as long as someone's not having active symptoms, everyone in those settings should be vaccinated, and that's how we're approaching it. And then there was the second part of that question, I think, was how does those outbreaks impact hospitals?
Our ICUs.
Yeah, I just think the skilled nursing facilities have done an outstanding job. This has been a really challenging situation. I'd like to thank everybody who works in one of these facilities, and I know how rough it's been for many months now. So thank you to all of them. But it is challenged, and unfortunately, these residents do end up coming into the hospital, and sometimes they're medically frail or have complicated medical conditions, and it definitely does impact our ICU. And that is, as Dr. Willis mentioned, part of the reason to focus on this sector is if we can vaccinate safely, that will help the hospitals, and that's an important goal of the vaccination program. So it's a very sad and unfortunate consequence of this pandemic is what we've seen happening in congregate living settings and in the skilled nursing facilities in particular. It's tragic. So I'd like to thank the county and all the people involved in doing everything they can to keep the virus out of these settings. But unfortunately, we've seen that it finds its way in despite our best efforts. And so I'd like to thank everybody for working so hard on this.
Thank you for that, Doctor. We have a question. Well, we have a lot of questions about rollout timing. And I know Dr. Willis, you shared with us a pretty detailed slide, not only about what is included in tier 1, but those kind of rollouts for tier 2. So I believe you sort of had a 2-month, and I'm pausing here because I'm trying to just scan all these questions to see if I can lump them into one for time. But how long do you think that tier 1, focusing on those essential health workers, those clinics, the other various definitions that you provided, how long do you think that rollout will take? And what's your best estimate on when our essential workers that maybe are not in a healthcare field might be eligible to receive a vaccine?
Yeah, that's crystal ball territory. But I think we have about 10,000 people in that tier 1, and we're looking at Pfizer vaccine. We were, as an example of how flexible we need to be, we were expecting 2 boxes, 975 doses per box. Up until a couple of days ago, they told it, and then they revised that estimate to be only 1 box. Fortunately, we've got the Moderna product coming, and that's heading to Marin Health. So we're we're distributing them as quick as we get them. And we would hope that if the schedule is maintained as it's predicted to, we would be able to work through that tier 1 by the end of the first week of January.
Excellent. And I do want to point out for those that are watching that Marin Health and Human Services has an informative webpage on the COVID-19 vaccine, which I understand they're going to be continuing to update with a lot of this timeline information. So if you visit coronavirus.marinhs.org/vaccine, there you can kind of follow progress updates as it relates to vaccine distribution and when we make that shift from tier 1 to the much anticipated tier 2 and tier 3.
I'm just
Yes.
looking at text, and there's an exciting little sort of holiday gift for us, which is that the Pfizer vaccine is supposed to be 975 doses per box. It's turning out to be more like 1,200 doses per box, because there's a little extra in each vial that is, and Dr. Shavelson and I were talking about this earlier, that we can actually get 6 doses out of each vial, probably pretty reliably rather than 5. And that's being observed across the nation. So that's an unexpected little gift, and we're taking good advantage of it.
And we should add, and this was my question for Dr. Willis, there will be sufficient for all of the people that get the little extra with the first vaccine. There'll be a little extra in 3 weeks for the second vaccine, because that was a concern that people had. So if we do 50 more vaccines today, will we have 50 more in 3 weeks? And the answer is yes. And so it's very exciting, and all the Bay Area hospitals that have the vaccine and have been administering it are doing this. So that's really good news. I just also wanted to mention, I know folks have a lot of questions about when they might receive the vaccine. And our Marin Health Network outpatient providers have been inundated with phone calls. And so we are putting out language as quickly as we can, and you're welcome to visit our webpage. I encourage you, though, to give your providers a little bit of breathing room. They're trying to see a lot of patients before the holidays, and they'd love to answer your questions. But as Dr. Willis said, that's a little bit of a crystal ball right now. So maybe hold off until early January. There's no early sign up with our organization at the moment because there's no landing date for the vaccine. So if everybody could just hang on to your excitement a little bit longer and contact your doctor early in 2021, that would be fabulous.
That is a great addition.
I think that's a critical point, especially if we're reaching the end of our time. I think there is no list. You don't need to worry that you're going to be overlooked if you don't put your name on a list. Every single Marin County resident will have access to a free vaccine, and that we're not starting to build lists of patients. So one of the questions we've been getting is, how do I get on the list? There's no list. The fact that you are here qualifies you, and there'll be processes through your healthcare providers mainly, and pharmacies, et cetera, to be able to get vaccinated when that time comes, but it's a few months away.
Okay, thank you for that. I didn't want to invite Max and not give him a few questions to tackle. Although I must say, I am truly enjoying this discussion, and I may loop back and ask one or two more vaccine questions before we wrap up. Max, I'm wondering if you can, we have a lot of little nuanced questions about, can I do this? Can I do that under the order? A lot of questions about clarification in outdoor spaces. So can you maybe give us, I know you walked us through that nice bulleted list, and that applied mostly to businesses, and that was helpful. So when we talk to our residents about the stay home order, can you give us an overview of what are the basic tenets of the order, and what are we asking the public to do as it relates to their own personal behavior, both indoors and outdoors?
Yeah, and I was trying to answer some of those questions that were in the chat about outdoors. So one thing that's really different about this this stay-at-home order than the shelter-in-place in March or April is that your parks and trailheads and beaches are open. So you can drive to a beach or a trailhead and enjoy that place. And I saw a number of questions asking why, the order allows someone to participate in like an outdoor recreation class, but also doesn't allow social gatherings. And that is a challenging thing to wrap one's head around. And I can understand finding that frustrating, even outdoors. And so just to go over the things that are, Lainey, you're asking, what are the things that are allowed and not allowed? So again, social gatherings are not allowed. Outdoor recreation is allowed. Retail, indoor retail, outdoor retail. Indoor retail is capped at 20%, except for grocery stores, which is 35%. Dining is pickup and takeout, or pickup and delivery only. Hotels, short-term rentals are closed. Campgrounds are closed. Some of the limited and personal services are closed, like massage or hair salons, nail salons. Anything I'm missing there, Lainey, that you're hoping to cover?
I think honestly, a lot of the questions, we're not really getting much in the way of specific business questions. I think that's pretty clear. Where our public is left is, and Dr. Willis, you may want to also chime in from a public health standpoint, understanding the reason, especially this time of year, when this is a time of year for gathering and families and friends getting together, understanding why the state chose to limit the mixing of households. And then while you mentioned that outdoor recreation is allowed, what are the precautions around that people should take? Do they need to wear their mask the whole time? And then obviously outdoor recreation doesn't mean, have a big picnic with a bunch of people from outside your household. So I think those are some of the questions people are searching for clarity on.
Yeah, I think we got to pick our battles here in terms of what are the most important things. Like, we are in a crisis state. We had 120 cases or something. I mean, for every 100 cases, we're going to get 10 in the hospital, 3 in the ICU, and that's just going to add up, and it's going to overwhelm our system if it doesn't stop. We know from Thanksgiving that indoor gatherings fuel transmission, and right now, the biggest single contributor is household gatherings of people from different households indoors, and it's play dates. It's not necessarily like the big party that you're going to throw. Everyone knows. Hopefully that's behind us. It's more around the edges of that. It's like, okay, yeah, sure, you can come into the house. We'll have, or they're over. It's getting cold. Why don't we go inside? That, when it's iterated over 260,000 residents, which is the population of our county, if that happens even a little bit regularly, that's going to hurt us. And so we need to all double down And if we're able to actually, I mean, if you think about it, it's about 10 days of transmission, right? So when someone is infected, it's about 10 days of interval where they're infectious to others. If we had some miracle event where no one who was infectious infected anyone else because they stayed isolated, we would have no cases by like New Year's, because those chains of transmission would be interrupted immediately. That's not going to happen, but that's the mental image of what we're trying to achieve here, because we're seeing the opposite. We're seeing more and more cases, and as more people are infected, they infect more, and that's the trend we need to reverse. So yes, there's a lot of nuances about, can I walk with a friend outside if we're socially distanced? Basically, those are not the core questions, right? The core questions right now are, how can we organize our lives around preventing indoor gatherings across households for the next 2 weeks, despite the fact that it's the holidays? We show love, we show, what we cherish most, our friends, our families, by actually protecting them and doing our celebrations remotely for the next few weeks.
Awesome. That's great. So with that, there are a couple of more questions related to that. And Dr. Shabelson, I do want to recognize that while we had originally confirmed you for 3 o'clock, we are going to roll a little bit longer. So if you need to go, we understand, but we'd love to have you stick around as long as you can. Dr. Willis, there's a question here wondering if Marin County is considering a bold move like San Francisco in terms of requiring a post-travel quarantine, which is similar to what we already have in place, only it really shifts it from a strong advisory to a required stance. Is that something you're considering?
We have a very strong, recommendation that people not travel. I think, again, this gets back to, we're sunk if the principles are not understood. I'm not sure. I'm not convinced that sort of enforcement is the answer. I mean, it is a fundamentally non-enforceable order in some ways, to say that every single person who has been outside of the region who comes back has to quarantine for at least 10 days. It would be ultimately, at the end of the day, voluntary anyway, whether or not it's framed as an order or a recommendation. We also need to pick our battles in terms of what we're really focusing on from a law standpoint. And our approach in Marin is to really rely on mutual understanding of our common goals and recognize what we're doing is for the sake of all of us. And so for that reason, I am not choosing to impose an order on quarantine, but rather leave it as a strong recommendation and hope that everyone understands within the context of their own lives how important this is for all of us.
Great. Thank you for that clarification. So I think scanning, we've already kind of touched on what's causing the current surge in terms of residuals from Thanksgiving and gatherings, and also some minor outbreaks. Are we still seeing a correlation between ethnicity and outcomes at all, or ethnicity and risk of exposure? Are there any trends there, Dr. Willis, that you wish to touch on?
Our vulnerable communities remain vulnerable. They are still overrepresented among cases. When I say now the majority of our cases are among our white residents, that represents a significant shift in the pattern, the profile of this pandemic for us. However, our Latinx residents make up 16% of our population in Marin County and are now about 40% of our cases. So they are still overrepresented as a group. And that's a reflection of their ongoing vulnerability, both from a point of view of being essential workers, more likely not to be able to work from home on the front lines, and also, crowded living conditions related to economic security and being able to make ends meet to afford rent, and having multiple people together in one smaller unit where transmission occurs in that setting. Those are economic realities that do correlate to race and do make certain groups more vulnerable. So yes, we are still seeing, but it's not the overwhelming pattern that we saw in July, where 80 to 90% of all of our cases across the county were among that subset of Latinx essential workers.
Great, thank you. So I think I'm going to tiptoe back over to vaccine, because we do have quite a few more questions, and it looks like Dr. Shabelson is still here. So in case she wants to pipe in, I want to give her that opportunity. There's a lot of myths circulating out in the community about the vaccine and how it works. And if once somebody is vaccinated, first and second dose, does the vaccine then only prevent symptoms, or does it also prevent transmission? Or is it too early to know? Or should I call Pfizer?
Call Pfizer or Moderna. One could theoretically be an asymptomatic carrier of the virus and transmit it. That is one of the concerns. We don't know how possible that is, but it is one reason that we are recommending that people continue to mask and socially distance and wash their hands. And also, the vaccine is not 100%. It's highly effective, but no vaccine is 100%. And so that is another reason. And I can say, even though I got my vaccine yesterday, and in 3 weeks I'll get the second one, and then a few weeks after that I would be considered to be fully immune by the vaccine standards, I will have, my life will look no different then than it does today. I will be masking. I will be socially distancing. I will be following Dr. Willis's orders to keep the community safe. So it is a light at the tunnel for all of us. People asked me yesterday, aren't you excited? Don't you feel safe? And I said, this isn't about me. I'll feel better. This is about what's coming for all of you. This is what will come in the next 6 months. This is just the beginning. I was never worried about me. I've always been worried about all of you. I never wanted to infect any of you. So that's the important piece here, is that we'll have to continue taking precautions. I think that now that this vaccine is being given in massive numbers, we're going to learn a lot more about it in positive ways, and it may dictate our behavior slightly differently. But for the time being, I don't think much is going to change. For the next at least 4 months, and Dr. Willis will probably say longer, we're going to be living life a lot like it is right now. Hopefully, if we can crush this wave right now, if we could do what Dr. Willis said and all stay home and have 0 cases, then we could slowly again go back to something being somewhat more normal. But until we see the community receiving the vaccine, none of us are going to be able to get together in big groups and take our masks off, unfortunately. We're a long ways off from that.
Awesome. Thank you for that added perspective as well. So the community is hearing these names, Pfizer and Moderna. Can you outline very quickly what's the differences between the two vaccines?
I'll let Matt weigh in if he wants to. From my perspective, there is no difference. If I had been told yesterday Moderna, I would have said, sure, rolled up my sleeve. If you told me Pfizer, which I got, roll up my sleeve. My family, my friends, my patients, equally efficacious. I think that one can spend many hours on Google finding differences between the two. From my perspective, there is no difference. They're both equal, and one should not select one over the other. Right now, all the data shows you can consider them synonymous.
I agree completely. For the public, they're the same in terms of their effectiveness. mRNA vaccines, very similar mechanism of action, super effective. And what a fortune, I mean, how lucky we are that's the case. It wouldn't have to be that way. It just so happens that SARS-CoV-2, the virus that causes COVID-19, happens to be vulnerable to this particular vaccine in the way it's administered, which is really fortunate for us. They're the same. There's differences on our end in terms of logistics, because the Pfizer vaccine requires ultra cold storage. The Pfizer vaccine is 3 weeks. The Moderna is 4. Did I get that right, Karen, or did I flip that? Yeah. Okay.
Yeah.
Right. So there's little differences, but in terms of their efficacy and safety profile and the way it's administered, it's the same for the public.
Great. Thank you for that clarification. Next question. There's people that have sought testing for antibodies to see if they have COVID antibodies. So if there are any individuals out there that do have some level of lab confirmed antibodies, should they still get vaccinated?
Yes.
That's an easy answer. Okay, great.
There are very few contraindications to these vaccines. There are certain specific situations that probably would be too detailed and take up too much time. But most of the public, a wide majority of us, will be perfect candidates for these vaccines.
Great. Thank you for that. So seeing that we have about 5 minutes left for questions, I'm going to turn it back over to Max, because we did have a couple of business related questions that came in. And these questions are around just the general notion of enforcement. And one example that was shared is restaurants that are perceived to be violating the order because they're still providing outdoor seating. So what does that enforcement environment or picture look like for Marin County?
Thanks, Lainey. And I think, I appreciate people reaching out about it. I think it's really helpful for folks in the community to continue to reach out if it's unincorporated area to the county, or if you're in a city or town, to your city or town, to report incidents like this. We have an education first approach, and a huge thank you to the businesses. I think they've really been heroes through this effort, closing down their businesses, limiting business to protect the health of our community. And it's really something to appreciate, all of that selfless approach to their work. And so I think that being said, of course, if there are businesses that continue to, have non-compliance with the order, we want to be able to connect with those businesses and provide education about the order. And of course, enforcement is a follow-up if non-compliance continues. But for the most part, I think we've really been impressed with how receptive our business community has been to the public health orders and how much our local businesses have stepped up to try to keep the community safe.
I just wanted to say really quickly, Marin Health wants to express deep gratitude to our business partners for all of your support throughout the pandemic, meals, other donations, and even just the act of shutting down. We understand the huge impact that has on your business and your family and your livelihood, and how difficult this must be, and that you're doing this for the community. And that's also benefiting us here. And so a little plug, I shopped local for all of my coworkers, and this is from a chocolatier who was put out of business because of COVID, and now she's doing it out of her home kitchen. And so buy local, shop local, do everything you can, and know that we all here at the hospital and in the network and in our clinics are doing everything we can to support local businesses. And we're so grateful for the gifts and donations you made to us and for the sacrifices that you're making. We understand there is a trade-off right now, and that some people are having a negative impact by what they're being asked to do. And so we want you to know we appreciate it.
That is an excellent close. I don't know that we can really cover any other business questions after that. And thank you for that really beautiful demonstration of shopping local and painting the picture between how even actions as difficult as shuttering a business can have a positive impact in our community. It's been a balance for sure. And I know Dr. Willis and I have had several conversations about striking that balance between our economy and public health. Excellent. So I think with that, we will wrap up, because we have gone a bit over, more so than I actually prepped our panelists for, but we really, truly appreciate the extra time that you provided us for Q&A. So thank you again for joining us. And formally want to thank all three of our panelists, Dr. Willis, Max Corton, and of course, Dr. Karen Shavelston from Marin Health Medical Center. Before we close, I do want to remind all of you that are watching either on Zoom or on Facebook that you can find all of the latest information about COVID-19 activity in Marin County, including vaccine information, general public health guidelines, whether it be for schools or whatnot, testing information, and more by visiting online coronavirus.marinhhs.org. And when you're on that webpage, you can also sign up to receive our daily status updates, which include an overview of confirmed case data and other updates on Marin's response to the COVID-19 pandemic. So to receive those updates, visit coronavirus.marinhhs.org/subscribe, and you can sign up there to receive them by email. Or if you want to receive them by text message, simply text the phrase Marin COVID to 468-311. Now, if you asked a question that unfortunately we didn't have enough time to cover at today's event, you can reach out to our COVID-19 response team. You can reach them online at that same website, coronavirus.marinhhs.org/contact. And we have a team of folks that if they don't know the answer, they're excellent at tracking down the response and getting back to you. So with that, I will wrap it up. Thank you again to our panelists and to all of you for tuning in today. And please stay home, wear that mask. When you do leave your home, physically distance, frequently wash or sanitize your hands, and above all, please help us all stay safe, Marin. We'll see you next time.